Hi, it's Dr. Mian from Neuro Wellness. Today I'm going to talk to you a little bit about erectile dysfunction. Now, erectile dysfunction is a disorder that affects many men, particularly as they get older. So a lot of folks in their late 30s and people who will get into their 40s may start to notice that there is a decrease in the firmness of their erections. And for some people, this can be very debilitating in terms of having a normal, healthy sexual relationship with their significant others. And for other people who are trying to have children or what, obviously can be problematic for very obvious reasons too as well. Many people between the ages of 35 and 65 will start getting this issue. In fact, 1 out of every 2 men actually will start getting this problem too as well. And you may wonder what reasons will cause something like this. Well, there are many common reasons, and one of the more common reasons is actually people who start getting atherosclerotic changes in the arteries. And in some cases, this actually may precede actual cardiac issues or heart issues too as well. Now, if this is really the first indicator of something like that, then any man who has this issue should certainly get their heart checked out, get their blood pressure checked out, their cholesterol, their blood pressure, and all of that should be evaluated by a physician too. For many people also, diabetes is a big culprit with things because diabetes actually affects your nerves, can affect the blood flow too as well to many different areas. So it's not just a condition that just affects your blood sugars, obviously it can affect many different organs, including your penis too as well. People who have had prostate surgeries or prostatectomies can also be affected and have issues with erectile dysfunction. People who have low testosterone too can also have issues with not only desire, but then also have issues with their erections too as well. So making sure that our testosterone levels are at an optimal level is also really important. And unfortunately, with a lot of people, this does decrease with time to a certain extent as well. And there are also other people who fall in other categories under neurological disorders. People who may have had strokes can have this issue too. People who have multiple sclerosis. People who have spinal cord injuries. And people who have neuromuscular disorders. A commonly overlooked thing that actually can cause erectile dysfunction are issues with anxiety, stress, marital issues. If these things are not addressed, then obviously these things can certainly affect your ability to maintain an erection. So how do you really define erectile dysfunction? Well, it's basically the inability to achieve an erection long enough for penetration as well as to have sexual activity. So what are the treatments that are out there now for this condition? Well, unfortunately, there's not a whole lot that's out there, at least traditionally. So one of the medications that first came out into market actually was Viagra back in 1998. And this medication was a game changer at the time, and it still is for a lot of folks. Afterwards, they came out with Cialis and some other medications too as well. They do come with their side effects too as well, such as having erections that last for days, which can be actually problematic, to having low blood pressure, dizziness, lightheadedness, and some cases can perpetuate other issues with heart attack and stroke and whatnot. So we definitely want to be careful sometimes when we take these medications. And obviously, if you use these medications with other nitrates or blood pressure medications, you can have a significant drop in your blood pressure too as well. What happens with these medications over time is that they may not work quite as well as we'd like them to. And that's primarily because our arteries are not producing enough nitric oxide. So these medications are predicated on utilizing the nitric oxide that we have. And if we start developing atherosclerosis, then what actually happens is that we're not making enough nitric oxide. So then what you're left with then at that point are only a few things. You can either use a pump or you could have a major surgery. Unfortunately, those things don't always necessarily appeal to people, but that's kind of what's out there. One of the treatments that we're offering here at Neuro Wellness actually is the Pshot or the Pshot. Now this treatment came on the market about 7-8 years ago, and it really has been really has shown a significant improvement in many people who do have erectile dysfunction. Now the way that this works is very similar to other regenerative procedures. Now with these injections, we stimulate the production of new blood vessels, and can help stimulate the production of growth factors too as well. So it actually helps rejuvenate and actually heal the penis to a certain extent. And when this happens, we're able to have more full erections. We're able to actually have more firmer erections. We're actually able to have increased stamina. We may actually also have increased sensitivity too as well. So with this treatment, it's actually a pretty safe treatment. It's it's a treatment that doesn't involve any other medications. And so it's not something that you would react to because it's your own blood. You may wonder, how is the procedure done? Well, it's actually very simple. We basically draw out some blood, we spin it down, we concentrate the platelets and the growth factors, and then with a proprietary technique, we go ahead and inject it into the areas of the penis that actually need the treatment. So then at that point, many people have very little downtime, so they're actually able to go back to having sexual activity in the next day or two. For some people, they may notice a huge difference after about a week or two, but most people may notice a difference after about 4 to 6 weeks on average. For some people, it may be a little bit longer to a certain extent. There are some patients that actually may need to have a series of injections that are done depending on where they're at with their health, whether it's their blood pressure, their diabetes, their testosterone, or other medical issues too as well. Sometimes this treatment can also be combined with other treatments such as shockwave treatment, which can be also very significant in terms of being able to have an erection and maintain an erection. So if you're looking for a treatment that's different, if you're looking for a treatment that doesn't involve drugs or surgery, then the Pshot may be the right treatment for you. If you have any questions or you're interested in this treatment, please give our office a call at 973-928-3288 and we'd be more than happy to help.